of the country's 200 million people suffers from mental disorders. In spite of this disturbing statistic, there's a shortage of experts and centers to manage the situation. But in a bid to tackle the crisis, a mental health expert from Nigeria's North Central Plateau state has set up an organization to assist people facing mental health issues. Let's get more from CGTN's Kelechi Emekalam.
An ongoing training session at Charis, one of the few facilities in Nigeria that offer mental health care services. The founder, Praise Horn, was inspired to set up the center in 2015 following a surge in mental health disorders. The organization provides a holistic approach that employs clinical psychological assessments, counseling, addiction management, support groups, as well as aftercare programs.
So people drop in here, to seek help over every and anything, even if it's just basic advice that someone wants, needs to be able to navigate through life challenges. You can come in here and you will talk with someone who will be able to give you the right kind of advice, and then in case you have a psychological distress, it could be trauma related, it could be anything at all. It's one place that you can drop in, and then get the help that is needed.
So far, several have benefited from the services here. 31-year-old Aminu Musa is one of them. He was only 13 and involved in substance misuse, resulting in drug dependence. Now he volunteers at the facility as a counselor to help others.
Started from the little cigarettes, to a few drinks, and then it progressed into more sophisticated drugs like narcotics. So I struggled along that path for about 10 years until I came to a place where I realized that even my very existence was threatened by these drugs. I couldn't function, I couldn't be in school, I couldn't find stability in a social sense.
About 60 million of Nigeria's 200 million population have mental disorders. A WHO report shows there's a considerable neglect of mental health in Nigeria. The only available policy document in Nigeria dates back to 1991, with no revision or formal assessment conducted since its formulation. The few facilities available are disproportionate to the number of people who need treatment. Now experts like Praise are looking to key influencers to help create more awareness and inspire more people to make mental health services available. Kelechi Emekalam, CGTN Abuja, Nigeria.